Hi, John Wasson again for the last YouTube for the Institute for Ideal Medical Home course. We all know about medical home criteria as described across the United States, which differ somewhat from the emphasis of the course in that the medical home criteria used nationally do not give much credit at all. In fact, only 3 out of 100 points for patient experience measures, whereas this course has relied on patient experience measures for a whole lot of practical reasons, and of course, to really attain a patient-centered medical home. The criteria are shown here for the NCQA and various other forms of medical home that have been put into place and tested over the last few years. The results of those tests won't be known for quite a while, and there's a lot of work required to go for the recognition to enter these tests. And so, rightfully or wrongfully, a lot of practices are standing on the sidelines in the interim, trying to figure out, is this useful, cost-effective, etc. It is a lot of work. We have online a wonderful presentation of how to do it if you want to do it by Donald Stewart. And what he does is lay out for you the realities. Shown here on the left is the type of work you'll have to do. It's many, many hours. And on the right is an example of what Don did just to document one component, that is, how does he deal with access. There are, of course, many, many components. Well, we've had the audacity to name our work for many years as the ideal medical home because we think it really lives up to what eventually will happen. That is, more and more use of patient-reported information will be seen as valuable. In the interim, how much does this course help with NCQA? For 21 of the points of NCQA, you have to have the appropriate electronic system for taking lab results, flagging them, writing prescriptions, costing prescriptions, etc. This course does provide some help with access standards, the registry, of course, that the patients load for you, guidelines, coordinating care, probably 18 points if you get half credit. By that I mean, if you look at the details of how the points are given, you can see how the materials and approaches and technologies provided in this course can probably get you half the points. Up to 33 points you should be able to get quite easily from the work you've done in this course, and the sources of that information are listed here. If you'd like more information about pursuing NCQA certification, please look at the full material set on the website. If patient-reported assessment technology and feedback can indeed not only help the patients, but help your practice do much better and perhaps even move towards certification, the question is always asked, well, how do I best get my patients to participate? Shown here are 4 prototypic approaches in the use of How's Your Health. The green approach is the strongest approach, where you just take it on and in every way possible, by reminders before appointments being the best, you ask patients to complete the survey. In that particular case, the practice got a huge amount of use over the first 6 quarters of its assessment period, and then, of course, use tapered off because you only need to ask patients to do this every couple of years, and so the practice was then able to use the data to improve care. Another approach is the pulse approach, shown in red, where practice may do a bulk mailing by email or actually by regular mail and ask all patients to participate. A third approach, and probably the most common, is gradual increase as experience accrues. That's shown in the blue. And finally, there's the purple approach, which is sort of trying to use it but not being very energetic about it. Which is the best approach? Well, we're not sure which is best, although the purple approach, at least shown here for that particular practice, shows a downward trend and improvement. What we do know is that you should take it seriously. The more seriously you take the work, the better the outcome, and the greater the intensity, the better. This is shown on this slide. Here you see two sets of practices, the ideal medical practices during the prototyping phase who'd volunteered to participate, and another group of practices that also volunteered to participate but never took the technology seriously. That's shown as marker of participation. The average number of surveys completed at 12 to 18 months was widely discrepant between the two groups. And associated with this discrepancy was a rather dramatic difference over time in the number of patients reporting, I receive exactly the care I want and need. In the before and after analysis, the results indeed were statistically significant. Okay, so you've gotten your patients to use How's Your Health in a good volume. Will that get your patients better outcomes? This study, a controlled trial, examined that question by looking at How's Your Health use alone versus How's Your Health plus confidence building through phone follow-up. Impacted the outcomes of patients with both pain and psychosocial issues over the course of a year. And what you see basically is that the combination was the effective approach, not just the use of the How's Your Health tool. And that's what IIMH is all about. We're not about saying, use How's Your Health and life will be great for both you and your patients. We're saying, take advantage of technology and build it into a new process of care for the best outcomes possible. If you'll recall this slide, across 51 practices where we looked at the agreement between medical home stuff, self-management stuff, and effective value stuff, we observed that they're all interrelated and that the IIMH curriculum helps you do this to get the results you want. The do this is to build the medical home and get on the same page with the patient, help them build their confidence and be better at self-management, and as a result, you're just going to get better outcomes. That's the suggestion of this data across practices like yours. Once you have 30 patients or more in How's Your Health, you will be receiving the Ideal Medical Home Report Card that shows how you're doing in so-called medical home stuff, how you're doing in the patient management stuff, and how your global outcomes are doing, as shown here. You'll be shown this in thirds, the high third, middle third, lower third, and you'll also be able to look at your performance across patient income groups and across illness severity. This information then allows you to monitor quite simply broad, important domains of the ideal medical home, and then helps you focus on areas in which you want to work or need to work to become an ideal medical home.